we were seeking to connect with a psychologist to help us understand the effect of coronavirus on the psyche of nations since it broke out last year. Aku Hefron joins us now via Skype. I hope you can hear us. Good afternoon. Thank you for your time.
Yeah. Sorry about that.
That's all right. That's all right. It's good to speak to you. Now, this is clearly a big headache. Tell us, what exactly is such a massive global health pandemic doing to the psyche of the public?
Generally, it's creating fear. A lot of people are scared. A lot of people are even getting into depression as a result of the fact that they don't seem to know how to go about resolving this problem.
Now,
they feel that there may not be a resolve, and due to that, it is causing a lot of problems for them.
Me about the interventions. Are there any at the moment? When you look at our healthcare system, do you see provision being made for the mental health of Ghanaians in these times?
Well, you know, not all of us are mentally strong. When I say mentally strong, I'm not talking about mad people. What I'm saying is that not all of us have the capacity to listen to such things and cope. Therefore, knowing ourselves, we need to know what we can take and what we cannot take. In that bit, we need to know the amount of information we can take a day. Some of us wake up in the morning and go to the radio and want to listen to everything that is going on concerning the coronavirus, and it makes us sick, feel sick rather. So we need to know ourselves and know what we need to do. Again, some people I have had the opportunity to speak to are of the view that those who came in earlier on before the quarantine period started may have come in with a virus and therefore are causing sort of what do I say, more like a scare to them because they don't know whether they have the virus or not. And if they do, how are they going to get the issue resolved? So that is another thing that they are scared of. But generally, I think that we need to adhere to the sanitary rules that we've been given and protect ourselves as much as possible. If we don't have to go to town, we shouldn't bother to.
Now, at the moment, I wonder whether there are structures available for members of the public if they start to feel anxious, if they are worried about their mental health. I know somebody who's paralyzed with fear, unable to leave her home since the first cases were reported in Ghana. What options are available to them? What can they do?
We have the Ghana Psychological Association. We have the Ghana Psychology Council. We have the Ghana National Association of Certified Counselors, who are nationwide. So if any of these people can access or have access to any of these people, specialists, they would be able to see them through their problems. there is no need to fear or panic. We need to send that information deep down into each and every one of us that there's no need to fear, because the recovery rate is quite high, So we shouldn't fear, we shouldn't panic. And those who have been playing prank on the telephone should stop, so that it reduces the number of people who are in fear. Again, I think our level of education generally about the virus has to be increased in order for people to understand the way it works and hence reduce their level of fear.
Right. Now, in the meantime, what are some of the basic tips that you would give people to use as coping mechanisms when they find themselves feeling a bit anxious and are unable to access any of the emergency numbers, for example?
Okay. So first and foremost, we need to know our level of mental strength, like I've said before. Then we can know what we can take and what we cannot take. If we think we are full, what we can do is to listen to music that will soothe us, or listen to something else aside coronavirus. Unfortunately, almost every station you turn to has some coronavirus issues going on. However, we can always watch cartoons, do things that are not coronavirus inclined, so that those can help us. I mean, let's socialize with our families. I realize that another thing is that a lot of parents are having problems coping with their children.
Yes.
Because so many of us are not used to living with them the whole day. So this is a time to bond as a family. Let's turn off the television if that is going to cause us fear and panic. And let's bond with our children. Let's tell them stories about things that happened when we were young. Let them tell us what they have been experiencing as children in school, wherever they've been. I mean, let's socialize with them. Let's socialize with our spouses, and let's have fun. Let's have fun. It's a troubling time, but we can convert it to a time of fun if we want to.
There's a lot of debate about whether there will be the announcement of a lockdown or not. And even in the absence of that, there are many people who are either in mandatory quarantine because they traveled from outside the country, or in self-quarantine because they may have come in contact with a known case, or perhaps they are non-essential workers at their workplace and so are stuck at home. Cabin fever is another big threat to them. Any ways of coping with that?
With the fever?
Cabin fever, being stuck indoors between the confines of four walls.
Oh.
Those on quarantine.
We should learn to cope with our space. And also, since we haven't been locked down yet, we should at least do some exercising around, not too far from our homes, but just around. Those who are in mandatory quarantine should be able to exercise a little in the room, do things that would help them cope, help them know that they're still alive. And of course, appreciate the fact that we're still alive, because some people are gone.
There is a lot to celebrate. Aku Hayfron is a psychologist. We thank you so much for your time and for your tips.